Ideas Lab session. And I hope that everybody now can light up the cameras so we can have everybody's perspective on this session and the gallery view. Thank you so much for joining this Ideas Lab session. Greetings to some good, friendly and familiar faces here. Gerard Bourbon from Sweden. Welcome, Gerard. Ines Antunes, George Matthew, Fernand George, yes, this is, and Vitor Batista, welcome to the ideation session. Gerard, maybe you would like to have some comments on the presentation so far, whilst we warm up here the Ideas Lab.
Great, thanks, Paul, and thank you, everyone. Really good presentations, very insightful and spot on. I think my key takeaways is that we definitely are far away from a really good collaboration across the EU, and the countries that are sort of taking the lead and the leap of faith on making this happen sort of need to sort of coach the laggards to make sure that they catch on, because otherwise it's not going to be as effective. And we really need to streamline this process and collaborate and connect and make it a EU-wide initiative, right? Otherwise, we're only as strong as our weakest link. So this is sort of my key takeaways. And I mean, at the end of the day, the more we do on this, the more we will reduce the cost of healthcare. And as you know, I mean, and you heard me perhaps in previous events, I keep repeating myself, but unless we flip the pyramid upside down and start treating the healthy so that they don't get sick rather than treating the sick, we're not going to be able to sustain the budget to continue to care for the people we have across. And if you look at the revised figures from the Robert Koch Institute, that more than 400 million people will be affected in one way or another due to COVID with secondary ailments, tertiary ailments, that is a big bill to swallow. So, digitalization, connectivity, all these different tools are going to make it easier, and it will help us reduce the cost. So that, I will shut up with that now.
Then thank you so much, Gerard. And rest of the participants, I don't see your camera, so that's okay if you are shy or doing something else in order to make something else useful of your day, and taking advantage of this wonderful group of participants here. And since we would like to deliver some kind of output for the European Commission on this meeting, I'm going to propose, if you agree, an exercise, right? So it's going to be like 5 or 10 minutes exercise. And the exercise consists in this: imagine just only for today that everybody's using now a COVID interoperability app, and it works, right? So we are all connected. We are all using the COVID app. The coronavirus is in a lockdown. We are making our lives much more enjoyable because we are controlling the virus. Now, think for that for a moment. It's a beautiful thinking. Now, let's now do a brainstorm. Is what other features could we build on top of a mobility health app? Imagine this. So what other features could be built on these apps in order to improve the health prevention and the health status of the population? Would you allow me a few minutes of your time for this brainstorming, because we might have an interesting conclusions? Let's do that. I'm going to invite you on the chat here on the Zoom. I'm putting you here the access to this ideation platform, and we will start by doing a little bit of a fresh thinking. So what other benefits we could have if everybody was already using the mobile apps for COVID traceability? And this is something that is already happening in China, and the Chinese government is already thinking about potential further uses of these mobile apps, right? So let's have a response here from the rest of the world, participants here joining. So if you'd be so kind to to join the link on the chat and put there some of your thoughts there. And meanwhile, for George Matthews, George, if you're here with us, and willing to share something like the cameras, we're happy to have you here, and as well as Paula Ribeiro and Vitor and Fernando Jorge.
Paulo, can I just make a comment?
Please.
Somehow, I think it might be also helpful. The last years, at least in Portugal, we have seen a lot of projects on interoperability regarding Europe. Okay, Portugal has led some of these projects, some of these pilot projects. Okay. Unfortunately, normally I'm on the other side of the interoperability rainbow. This, I mean, normally I'm called to help in interoperability issues inside hospitals. How do data goes from one department to the other, or from one machine to the other? So normally we are not concerned about health data going from one country to the other, but from one floor to the other. What would seem to be much easier, but it isn't. And I really think that some of the things that we need to tackle here must be, we have to put our feet on the ground and understand that if we solve these issues inside one small region, one small city, then we can work it out between countries. And the other way around, it's much harder, because then you'll bang like against a wall once you get in touch with the systems that exist on one particular place. Okay.
I totally agree, and this is a good start of the discussions. But for the moment, what I'm asking you is to create, like, you know, the carrot effect, the carrot of the donkey that goes after the carrot, like the reward, right? So imagine it, and this is the conference of the future of Europe, right? So imagine now for 5 minutes or so, let's brainstorm what else could we have on the mobile phones as a health app that would benefit, you know, the whole population, or the health prevention, or whatever. So let's go now blue sky thinking for 5 minutes or so. I see that most of you already have access to these, and let's take advantage of the power of the brains, collective brains here together, and ideation something. This will be like the carrot that we put forward. And then, of course, we go back to the present, as you say, Ricardo, and we'll summarize these important advices that we're going to have in these three aspects that Diogo already said: technology, people, and process. These three, the triangle, no? Technology. So we'll create 3 breakouts, one for each, and then we'll.
Do you want us to write or to say?
No, right now it's for the ideation. If you have in the platform, I have starting. You have in the Zoom chat ideation. So let's think of ideas of other uses of health apps that you can think about, imagining that the world is already connected, everything is interoperable, all the data are, you know, all the countries are interconnected. We are a single European space.
So it's like a trip back to the future, sort of in the movie. Okay.
In 20 years now, what could we do?
You mentioned, Paul, you mentioned China, okay, being more advanced in this area. And having worked there and having communications there, I can say that yes, it is more developed in this area. Over there, a lot of people use digital gadgets, which you think that will not be able to do so. I have, for example, the grandmother of a friend of mine, because I said I found it very strange that she goes, for example, with an app. She has all her health information in there. She also goes shopping with it, okay? And that's all she needs. She doesn't need anything else. She doesn't take things with her when she goes somewhere. What happens? And I asked, don't you feel strange that you go to a supermarket, and people know you by biometrics? Okay, she'll go to a supermarket and biometrics will know who she is. she'll get the milk and the bread, and she'll walk out, and that's okay. There's no payment, don't you feel? This is very unusual because people, especially senior citizens, they are used to a certain routine, and this is not normal for them. And she turned to me and she said, when I was a child, Andreia, I didn't use this. I would go to the corner shop and also get the milk and get the bread, and there was no need for anything, because at the end of the month, then my dad will go and make the payment of it all. So they used it in the same way. So sometimes we think that the citizens, the processes, yes, technology, very important. How are we going to get there? Like if we're thinking about these kind of things in the future, in an application that will have all this information, including, for example, all your health data, where you can be anywhere in the world, and through on your mobile phone, you have everything that you need, your medication. So anyone, wherever you are, people know that if you have an attack, or if you have, for example, a hazmat attack, something that you can have, what kind of medication you're having for that. Can you buy it in that country? Do you have the same possibilities to do that? So we're thinking about the future. Yes, we're going to get there. One thing that no one said was that was going to be easy, but it's not impossible, and we can get there. Now, we need to go step by step, like Ricardo was saying. The first thing, we need to have the infrastructures to do that. We need to know how everything can work together, because that's one step that we need to do. The second one, that it's all the gadgets and all the equipment and all the things that we can have that will make it very useful for people. And the third one, yes, like I heard here, is the training of people on digital skills, because it is very, very important. Not everyone speaks the same language. We're all from different countries, we're all finding a common language in English, but when we're talking about digital skills, we do not have a common language yet. So that needs to be done. And the citizens will need to have that common language as well and be familiar with it. It has to be second nature almost. And it needs to get there. It will take us a while still, but we cannot linger on. We have to be, we are here, we are in a rush, and especially when we deal with health data, it has to be quick. It's like an emergency. We are in the emergency part of the hospital. So we need to really get our things together and start moving in that direction.
Absolutely, absolutely. Okay, and I see already very interesting ideas in this warming up exercise. I see that we have now Nuno Perry also in the room. Welcome, Nuno. Please turn up the cameras. We are now in the Ideas Lab session, and we need to structure now a little bit of our working together here in order to make sure we get some final outcomes for the session, as we are going to finish at 5 p.m. Central European time, 4 p.m. Madeira and Portugal time. George, Inês, Fernando, if you be so kind to light up the camera and have a check-in with the group here. Otherwise, we'll split for breakouts and hope for some conclusions.
Yeah, a quick comment before we jump in. Good insights from Andreia. Although perhaps maybe China is not the best example, right, from a mandate perspective, because it's a very different type of government, right? There is a big difference between the rule of law and the rule by law. So just the difference in those key words, it's very, very different. I think in Europe, we will still have issues with privacy and so on. There will be a handicap to achieve the dreams that we all have to be fully connected and to make that happen. Anyway.
Okay, Gerard, thank you so much. Victor, I see you have the video on. Welcome, Victor. Glad to have you here.
Hello, I'm Victor Batista from Present Technologies, a software company from Portugal. And yes, first time in this type of events. The idea I've added is to extend the concept of contact tracing to elderly people who might even don't have a smartphone, okay? And actually, we are working on a research project related to this, where people in elderly houses might use a smart badge who has Bluetooth connectivity and also other type of connectivity, but you can trace the contacts, and you can have non-contacts to people who live on the same room, for instance, and they won't be problematic contacts. But if someone visits the elderly house to visit her parent or her mother, when he enters, he can put also a smart badge, or he must put a smart badge, and tomorrow you will know with whom, if someone gets positive on COVID, for instance, you will know the contacts that that person has had, exactly as we have with the smart apps, which we have in different countries, and which haven't had the success expected in terms of usage. I think it is because of a few problems. But yes, the idea here is somehow to bring the concept to elderly people. And at least here in Portugal, we have a lot of elderly people who don't have a smartphone, and having this contact tracing also to them.
Fantastic, Victor. Good idea. I'm sure you already typed it in the map. We are seeing now lots of idea coming up in the map.
Yeah.
It's good to have these inputs, as we are going to have a report from this later on. Inês Antunes, welcome. Inês.
Welcome. Nice to meet you. I work for SPMS with Diogo Martins. I'm involved in the Cross Health project, cross borders, and I came here to really have an insight and have your feedback on traceability apps, and the theme is interesting to me.
Fantastic.
And I say that I'm a former student of Professor Ricardo in the Faculty of Medicine. I did a post-graduation in medical informatics in Porto. So it's nice to see you again, Professor.
Thank you, Inês, for your checking in. George, Fernando, and Fernanda, are you with us? And if not, then perhaps we can have a quick look at how the outcomes of the ideas so far. And I'm sharing now the screen again. So this is wonderful that so many ideas come up in just a few minutes. And this is definitely attractive. It's a path that we can explore, in the sense that the potential of the future of Europe and the future of the health in Europe can go to this direction. We cannot avoid the digital world, and definitely 5G is going also to bring it further potential to the use of the digital app. So we have an agreement already in the basic traceability hub. Let's now find the next map and the next solutions and the next challenges as we are going to face. So I prepared another session here for us today in this group. And eventually, I think, since we are not so few in the room, we expected 30 or more in the room to create breakouts, but maybe we can have a parallel thinking session here on the conclusions of our discussions so far. And I'm going to invite you now to this second map here for this conversation to get on a closure in terms of what are these three elements. So we got already observations from Ricardo on the importance of being cautious on interoperability, but there's also advices that we can give on in terms of people processes. And so since we are few in the room, I would say that instead of creating 3 breakouts, I would propose we stay in the main room and make comments on the parallel session, as we have this wonderful tool for our conclusions here. Unless, of course, we see more people lightening up their videos, and then we can do the breakups. Fernanda, Ricardo, and I see Paula Ribeiro is with us, but it's not with us. Perhaps she had some important things to attend. So let's do a recap on the conclusions so far. Let's use this final map to make observations of the most important aspects that we have heard here today. Some perspectives that we can summarize in this final map. So 3 areas: technology, recommendations, and people and recommendations on process. Let's take now 5 minutes of quiet time to do these, and then we'll go back to YouTube live for conclusions and the wrap up.
Paul, we having breakout sessions, right?
I think that since we are very few of us,
We just stay here, okay?
Yeah, let's take in main room but let's work together on the conclusions for this map that I'm sharing, because we have already seen some insightful comments, and we can type them there, and then we'll go back to YouTube Live for the final conclusions. And meanwhile, hoping that our other participants who are in the room and then with us, they could comment also, or type in their ideas as well. So let's do that. And in 5 minutes, we'll go back to live event and share some more comments and conclusions.
Sorry, Paul, are you sharing the screen?
No, I'm not. I've put the chat on the chat. Have you put it on the chat? Yes.
Okay, yeah.
It's better for us to work individually now. I mean, not individual, because everybody's seeing everybody else's idea. But
okay. Don't worry. I didn't follow the link.
Okay, so I see already breakout one has already lots of comments. So it's interesting. Maybe this is a good sign. But there are also other areas that we need to address when thinking about the issue of traceability apps that should be working. So recommendations, Ricardo, like you just said, going slower, trying to go step by step. This is important. And we are seeing already here interesting comments of the aspects of the digital literacy, which is so important. And also, I think, why not also in terms of media, TV programs? There's so little understanding of what are the real challenges with the coronavirus infection and so another 3 minutes to go. As we have some ideas like are very generic, like interactive terms, if you can expand on that and put in a little bit in the details, if you double click on the idea, you can add a little bit more comments and expand on what you mean by interactive terms in terms of the process perspective. Great comments coming in. Thank you so much. As it's good to take advantage of this time for something that we can leave behind. And of course, this is a preparatory work for the Altata Forum that we're going to be hosting in Porto, 27 and the 28th of October. And definitely with a lot more participation from now on. This is just starting the discussions now. So 1 or 2 more minutes to complete, and then we start the live session again as we.
Paulo?
Yes,
I have one suggestion, but I'm not really sure on what column should I put. So I'm just going to say it, and maybe you can help me select. One thing that I really think that might be a big difference is we are still having a lot of tenants being made where clients buy technology, and probably we should be shifting into buying results, health results. And this will probably help a lot, make the companies understand that they need to focus more on what actually works and not only actually works for the citizen and not in an informatics sense. Okay.
Mm-hmm.
I'm not really sure on.
I think this comment should be going in technology because because it's the same for the pharmaceutical industry, right? They have to find the ways of focusing on results more rather than the products they sell, right?
Yep.
I think it's a very powerful comment. Thank you, Ricardo, if you be so kind to leave it on the record for us here. Gerard, you like to say something about that? I see you're moving in when I talk about pharma.
No, I mean, I agree with the comments. I mean, with Big Pharma, I think that there is a lot of work to do that we can all sort of steer. I see right now, if I had a magic wand and I could steer pharma in the right way, I will make sure that they start putting a lot of money and attention on the new antibiotics. I mean, we're running out of antibiotics, and it's a big problem for us to tackle in the future. So, I think we're taking our eye off the ball, just like we were not prepared for COVID, and we're still not prepared, because I would like to see the EU huddle and say, well, how can we mitigate the next pandemic or the next big variation? I mean, we're still just sucking for air right now with the Delta variant, but the antibiotics issue is a huge global problem, and it can hit us really hard.
Definitely.
Yeah.
Okay, and that's, I think, about it for today. Let's do the wrap up now live for our audience and our viewers that are probably expecting a little bit of us, and we can have a lot to comment on these results that we are having here ahead of us. Also, we'll be sharing, and so without further ado, let me start the live on YouTube now. Using the Altata Forum. And I think we are now live, dear viewers, and thank you so much for watching this presentation. And this is a great pleasure to have you all here. I have to apologize our viewers because by mistake the last streaming was done in the Digital Health Portugal channel, not in the Health Data Forum channel, but we'll fix that by swapping videos later on. I hope that in the social networks you'll be finding us anyway, because I've shared already the stream on the relevant channels. Apologize for that, but now we are in the correct channel, in the Health Data Forum channel, and this is a preliminary event for the Global Summit we'll be hosting in the city of Porto. I have here with me the reminder of guest panelists that joined for the day session: Andreia on alphabetical order, Artur, Olesch, and Ricardo Correia, that I will be giving them the floor momentarily. I have also here with us a guest, a dear friend and former speaker of Health Data Forum Global Summit 2020, Gerard de Bourbon. Gerard is from the INL, the International Nanotechnology Laboratory. It's probably the sole exclusively research laboratory dedicated to nanotechnology. So it's really a fortune to have INL based in Portugal. It's not a Portuguese laboratory, it's an Iberian organization, one of the few Iberian organizations that I know, founded by both Portuguese and Spanish governments. It's located in Braga, and Gerard Bourbon is a special projects manager in that organization. And he has been with us in Health Data Forum last year. Already Gerard in the ideation session has presented thoughtful comments here. So I'm sure our viewers here and this live broadcast will benefit from our live conversation, our fireside conversation now. And just for a quick reminder of what is going to be the Health Data Forum, I'm going to share with you what we have already in place for program and not yet finalized the venue. We know that it's going to be in the city of Porto. We want to build up on the tremendous success of the Health Summit, where I was also personally involved there in hosting a number of roundtables. The contents of the Health Summit will provide a good starting base from us to steer the discussions. This is our conference today. We are doing this Holy Grail conversation on the conference on the future of Europe. And then we'll have a strong agenda with opening keynote by Lord Nigel Crisp, a good friend of Portugal that is going to visit us again in the fall. And we're going to create a future search conference, definitely in this space of thinking about what could be the future of global health and health data. Already opening keynotes, Luís Pinheiro, he could not attend today, is going to be there, and also Céu Mateus, a professor from health economics at Lancaster University, Suzanne Gaunt, she's the president and CEO of the International Consortium of Health Outcomes, and repeating also as a guest speaker from last year, Dr. Jacqueline Conaway, and she's bringing a perspective from future foresight strategy. She's also going to be with us. Raphael Grossman, and a medical doctor and a futurist, is going to hopefully be with us also in Porto to bring perspectives on how to use 3D virtual immersive reality onto the healthcare process, and particularly in medicine. George Matthews, also a medical doctor. I'm sure George is trying to reach us because he's here in the session. Is also going to be with us in Porto. And of course, Lars Montelius is the Director General of INL's partners in this initiative is going to be, and among other speakers that we're going to have in Porto. So the agenda will be for 2 days. 28th of October, we'll start in the middle of the afternoon for the ones who are in the local space of Europe. This will be early in the morning for the Americas, North America, 7 a.m. North America, Pacific Daylight Time, 3 o'clock, 2 to 3 o'clock UTC. So we'll have the welcome and the plenary session. Then we'll have a hybrid knowledge cafe. So it's an interactive session to start off warming up the conversations in this community. And then we'll have a final panel with the conclusions that will be at 5 to 5:30 UTC. This will be 10 a.m. To 10:30 Pacific Daylight Time. So this will be the first day. And then the second day we'll start on the European round of talks. It's going to be 8 to 9 UTC, an opening plenary. And then we'll extend these hybrid peer conferences to Brazil and India in the afternoon, as we expect that guest speakers and also participants from India will joining us, and as well as Brazil. And we'll have a conclusions plenary precisely at 3 to 4 UTC. This will be noon to 1 p.m. In Brazil. So this is part of an ongoing series of events that we have since last year. And we are hopefully that all the guest speakers here with us today will be also joining us in Porto, and also to have your participations. So that's it for Health Data Forum, and perhaps under alphabetical order we can start, and Andreia, call out what will have the most important takeaways from this session so far.
Okay, so what I can see from now on, very exciting ideas in terms of also bringing the children along to this with gaming. That's a new thing, which is a very interactive. I was talking here about the processes perspective and technology as well, where we can be more interactive with people. And usually the law is one of the things that lies a little bit behind because of all the numerous words. And when we're talking about these applications, usually you have to click yes or no, agree, but you have, you know, a statement of terms and conditions, and not many people read it. So I think as lawyers as well, we have to go past there and be better at communicating with people, with a normal citizen, which people are used, especially children. We're talking about having gaming and interactive games, learning about the digital world from school age, and this is very important for the future. This is very important, and the children today, they want something quick. They are used to these digital gadgets and they want information very quickly. So when we put on a lot of terms and conditions, people are not going to read it. They're just going to click, and this is the truth. So knowing that, how can we go over it? Nowadays, when I'm talking about privacy made easy and being more interactive, is even like with citizens, having like chatbots explaining the things to people and interacting with people and talking about it, giving the answers, instead of having statements that we just click. This is something that we should think about. As Ricardo was saying as well, when you develop something, there's lots of even the informatics, they don't have all the knowledge that they should have. So for medicine, for specific areas such as health, and also for specific areas such as privacy when they're developing something, because it's so complex sometimes that one person that is focused on the technology side of things and how things operate, interoperate with one another, they cannot have the whole dimension. So it's the most thing that I've taken from all this is about collaboration, is having different experts and different people putting their heads together and making the next step together. This is what I feel of it. Very good ideas for health, for digital literacy processes as well, creating profiles as well for people, not just in terms of health, but having more regulations in a way that it's that makes it like a journey, like an experience journey. And this is something to consider. But very good ideas on on all three areas: technology, people, and processes. Really happy that people are really thinking about it and putting their contribution to it, because only together we'll get over it.
Fantastic, fantastic. Thank you so much for these observations. Perhaps, Ricardo, you want to add in something?
Yeah, I think that's currently we are living in a moment where everybody feels that data should be put to work for themselves, which is, I think it's good, and we are moving from a moment where we were more we thought about technology in the health area as being something that in the future would bring some good things, but now we are more on the level of the necessity. So we want all of these things for now. We need them now, and we get more and more uncomfortable with the idea that all our problems are occurring and we don't have an answer of the level of our expectations. Okay, and this is useful, but at the same time, we need to refrain from making things in a very fast way that won't solve the issues in the future. So we need to take advantage of this stress to make good solutions, not something that will work just for a couple of months and then it will stop working in the correct way. And so I also feel that, and the comments are going in that direction, a lot of concerns regarding security, but at the same time, usability. And this is something that, again, and stressing on something that Andreia said, that's another thing that the developers are not good at. Again, I am a developer myself, and sometimes we need to do everything, from databases to programming to workflows, and then design. Nobody is good at everything. And I must assure you that a lot of people that do software applications are obliged to make forms and user interfaces, and we are not good at, well, some of us are not good at it, but still we need to do it. And so we really need to have experts on all of these areas and working on this. One last thing that I really think that is, I didn't see this on this brainstorm, so I added just now. One thing that COVID has taught us is that we need systems that are very easy to be adapted. And so new systems need to be made in a way where I can add more data to be collected easily, that we need workflows to change. And so we need solutions that, well, currently we call those solutions low code or no code, but we need solutions that can evolve very easily without having to spend a lot of hours of programmers doing those. So this is something that is not easy. They are harder to do than the other way around, but we really need this if you want to adapt to new realities very fast. Okay.
Fantastic, Ricardo. Remember, you're going to have the final word, so don't leave for the moment. Artur is here with us, and I'm going to ask him to takeaways from the session so far. Artur.
I'm just watching the board with all the ideas from the brainstorm session. And I have to agree with Ricardo about interoperability and about data, because of course now we are thinking about solutions, about apps, about IT system, about electronic health records, about infrastructure. But in 10 years, or maybe even in 5 years, but for sure in 20 years, the data will be in the focus on all processes, and everything will be based on data. And we will need a high quality data for secondary use, and high quality data to improve some processes in healthcare, like for example, prevention, or like for example, epidemiological surveillance. So data will be on the focus on everything that is happening in healthcare, like it is already in other sectors. So we have to think about solution today and interoperability, but also what will happen in 10 years, because this mistake we made already with interoperability at the beginning, because we didn't think about this so much. It wasn't so important. We were fascinated with all these solutions that we had, technological solutions. And what happened now, we have a little bit mess in this area. Yeah? So even some systems in one hospital don't communicate with each other. So it means that we have neglected this topic. I like the idea from the brainstorming session that if we talk about mobile apps, maybe we should start slowly thinking about one app, just like, for example, iPhone has health app, and we could take like a puzzles, other apps, to coordinate how they are working together. So the citizens, individuals, they don't have to use so many apps. They don't have to download so many apps. We are a little bit tired of the number of apps that are available. So for every task, we have another app. We have another app for banking. We have another app for communication. We have another app for prevention, maybe another app for a prescription, electronic prescription, for COVID-19 tracking system, for certificates, and so on and so on. I think that people are tired of so many apps having on iPhone or over a smartphone. From the perspective of people, for sure, education. We have to change the medical education approach we have now, because I think that doctors and nurses, they have these programs, access to education programs, same like in 19th century probably. Nothing has changed so much. It's still focused on medicine. And it's of course important because doctors have to cure patients. So medicine as a knowledge is a key. But so many things have changed. Among them, for example, how doctors are communicating with patients online. Telemedicine is not the same as one-to-one contact, as direct contact with a patient. So we have to change it. Doctors and nurses have to learn about IT systems, about AI, maybe even basics of programming. This is something for children that they should learn this at schools. Yeah. Communication in digital age. Doctors have to know how to speak to the patient if he or she can see a patient only on the screen. And from the third perspective, processes, I would like to strengthen once again this bottom-up approach. So healthcare is happening in the communities. Healthcare is happening on the individual level. We have to empower patients, and we have to create healthcare system that is focused on local communities, because health is happening in local communities. We have to connect two now separate systems. That is a social system and healthcare system. So patients have a one transparent journey and one experience. And of course, privacy, but privacy by design. Patient, when using, for example, a mobile app, don't have to read or check all the checkboxes, put all the checkboxes and agree on that and that and that. It should be privacy by design. Without reading long documents, just being sure, okay, my data is safe and I have control over the data that is covered by this or that app. That's it. Thank you.
Fantastic. Thank you so much, Artur. And I see that Gerard is now off on this camera, but I have here with me George Matthew from the United States is going to make an interesting, fresh perspective on this. Oh, and Gerard is now back line. So maybe I will invite you now, the two of you, to be in the spotlight and have this contrasting conversation on George and Gerard, the two former speakers of Health Forum Global Summit last year, and hopefully also from this year too. George, a fresh perspective from the US, and then Gerard, also some comments on the ideas produced.
I hope it's fresh. I've heard most of the people here, so I don't know if it'll be as interesting, but I'll do my best. You know, Artur I think made a very good comment before about trying to encourage health from the communities as well as privacy by design. What we're seeing here, and we saw this with COVID-19 last year when it came to contact tracing apps, you know, Apple and Google came forth after going to the White House and basically told all the states, we've solved it. We have a privacy protecting app that will work on Android as well as Apple platforms. Please sign up. And the sign up rate has never been very good because people, because of whether it's post-Cambridge Analytica or otherwise, realized that there was no protection for their data and they didn't feel comfortable using it. And that hamstrung us here in the States, and it still is, because we don't even really have a GDPR in any way here. Many of the privacy laws are state by state based, and it's eroding trust not only in these technologies, but in some ways the healthcare system itself. So, you know, whether it's for COVID-19 or healthcare in general, we do need major reforms, not only in how we deliver care, which I agree totally that we need to redesign it from the bottom up and actually encourage peer-to-peer and community-based health with some support from healthcare professionals. I'm an internist myself now. I practice part-time. And what I'm seeing with patients now is, in many ways, they are very digitally educated. They're used to looking things up. They ask much more intelligent questions than even 5 years ago. And they need the tools to be able to make the proper decisions, where we as healthcare providers can become trusted advisors, not just paternalistic, do what I say type folks. As for the design that needs to be underlying it, and this goes to how data is obtained, we have, just like with apps with end user license agreements, which pretty much sign everything away to the company that puts it out, consent in many healthcare systems and hospitals and payers here is also fairly global. And I think patients are now noticing that many of these healthcare systems that they go to for care that they pay for are now using that self-same data to now make digital health companies or sell the data directly. I think it is going to come to a head here, and ultimately we'll have to come up with more transparency and differential consent models that allow people to fully understand what they're signing up for. The recent World Health Organization document that came out on AI and healthcare specifically highlights that there is an inequality, almost an arbitrage opportunity for many organizations where they get people to consent to give away their data, but the information asymmetry is so great that people don't understand what's happening. But as more and more of these observations are being made, people are beginning to understand what's happening and how their data is being monetized and used in some ways against them. So that'll have to be reformed and change as well. But ultimately, I'm in agreement with what people have been saying up until now. We need to make a change, and it has to happen soon.
Fantastic, George. And Gerard, how about your complementing view on this?
Well, I'll start with teeing off with what Andreia said. I mean, we need to make things simple, right? And simplicity is going to be the key. The other thing is going to be empowerment, right? We need to really empower people to make their own decisions, to take control of their own health. You know, right now with wearables and you know, graphene-enabled patches, we can collect a lot of vitals with different devices that can be correlated and aggregated and effectively and efficiently, you know, parsed and viewed. And I think that we can know more about our health by really taking all these different samples with the different technologies that are available. I think from a GDPR perspective, we're going to be okay in Europe because it is strong. But I mean, as I said before, it needs to be united in a concerted effort to make that happen. The third element of that will be when it comes to the empowerment. I really believe that nutritional medicine is going to be a bigger deal, especially considering of how many people that have been asymptomatic with COVID or have had COVID have gastrointestinal problems and other types of issues. I really believe that our monitoring our gut and understanding what we eat and how it agrees with our system, which is very different from person to person, will make a huge difference. So eating better, wellness, all of that combined will make a gargantuan difference to our health and how people can be empowered to make a difference for themselves and their families.
Fantastic, and thank you so much, Gerard. And it's a pleasure to have thought leadership in this conversation here shared. So we are now approaching last minute of our live broadcast, and as promised, our panelists, just one word only as a major takeaway from this conversation so far, and alphabetical order: Andreia, Artur, and Ricardo. So one nugget from this conversation for cutting the transmission now.
For me, it's not easy, but it's not impossible. So we can do it.
Thank you so much. Artur?
Health literacy from my side.
Fantastic. And as promised, Ricardo, your final word.
I would stress on quality data for life.
Fantastic. Thank you so much, everybody, for joining this session. Thank you so much, dear guest panelists, for taking these 2 hours of your busy lives to be here and volunteering, sharing all this knowledge and information. Thank you so much, all the Zoom participants, but in particular, George Matthew and Gerard Bourbon, and glad that you could show up your video feeds and share with us. And hopefully let's meet again in persons or not in Oporto, 28 and 29 of October this year. Goodbye for now.
Bye-bye.
Okay, and stream is over. Thank you so much, everybody. Thank you for joining, and let's keep in touch for next moves. Andreia,
okay.
Have a wonderful rest of the week in Madeira. I wish I could be there.
Yes, I know, it's lovely. That's one thing, it's here. It's lovely.
And hopefully we'll see you soon in person, guys. I was supposed to be in Braga actually today, but my trip got canceled because of the increased Delta variant.
Oh, I got it. Yeah, you did it well. But maybe we could do a pre-event from Braga, Gerard. That's
exactly. I mean, I was looking forward to have some vinho verde and a little Douro and pastéis de nata.
But I send a note to you and to Lars as let me stop the recording here as we